The country's public health system. The Union of Clinical Officers has announced the resumption of the strike, which starts midnight tonight. We speak to George Gibore, the General Secretary of the Kenya Union of Clinical Officers. Keep talking to us. The hashtag to use is TV47 News. Send us a message on 22047. George, good evening, and thank you for making time for us tonight.
Thank you very much, Abu, for having me this evening to enlighten Kenyans on the status of the health sector in Kenya.
All right, on the 1st of January 2021, clinical officers in the country resumed work after 26 days of long strike that had paralyzed the country's health system. This was after a deal was inked between the union and the ministry. It is a week since that deal was inked. You are making a U-turn on that, are you?
We are not the one making a U-turn. Abu, if you may, I may be able to remind Kenyans is that the Kenya Union of Clinical Officers issued a strike notice on 23rd November, and they had their strike started on 7th after the government failed to address the issues raised on the strike notice. And after 26 days on the strike and engaging the government under the umbrella of the Ministry of Labor, where the CS Labor appointed a multi-agency team that have been negotiating for all those days, where the Council of Governors was present, the Ministry of Health, other stakeholders including Treasury, SRC, and even the employee, KFE, Kenya Employee Federation. So when you look at all those people, they were on the table when the negotiation were happening, and we during that conciliation, which the Council of Governors fully acknowledged that was in place, the end result was that we had a return to work, which provided for the Kenya Union of Clinical Officers member to actually go back to serve Kenyans on the 1st January 2021. It was just even a turn of event when we realized that the governor later on said that they were not fully consulted, and they said that they are not party to that. And
George, let me interject you at that point. We will come to what the Council of Governors has said in reaction to this agreement. But you agree that on the 1st of February there was a deal that was reached to bring a consensus and chart a way forward, isn't it?
Precisely.
And this deal was between...
The deal was between the Kenya Union of Clinical Officers and the employers, that is the Ministry of Health, and the county governments under the umbrella of the Council of Governors. All of them participated. This is not a document that was prepared on 1st January. It is a document that had taken time to come up with, and the Council of Governors fully participated. And indeed, in their letter, if you saw the letter that they gave out, they addressed the CS Labor on 4th of January, the document was very clear that indeed there have been a negotiation that has been going on, and that was the result of that negotiation. And now they started running away, and they actually now resolved to intimidate our members and continue coercing them to give them, including even a dismissal letter. Let me say this, that people need to get to know that the chair Labor Committee in the Council of Governors is Honorable Ngwai. Honorable Ngwai is one of the signatories of that document. He's the one who actually appointed the representative of the Council of Governors.
All right, and just George, for purposes of clarity, you say the Council of Governors was party to this agreement.
Precisely.
But a letter in which the Council of Governors addresses to the ministry and Kenyans, the Council of Governors says, and I quote, that we also note that each county is an employer and the recognition of agreements are county specifics.
I think that is their statement, and if that was the position, they wouldn't have participated in the negotiation of this document. And I want to remind you that even the Kenya Medical, that's KMPDU, was on strike, and they call off their strike on 23rd, I believe so, December, and on 24th, When they were calling off the strike, the Council of Governors was represented, that's the Honorable Ngwai was present, and on 24th, through a Twitter, the Chair Council of Governors appreciated the process and actually congratulated KMPDU, encouraged other union to follow suit. And he said that he want the process of negotiation to be fast-tracked so that we can be able to end there. Then when the result now of the conciliation comes out that we are going back, he was fully consulted. He was called and actually acknowledged that this is a good gesture, and he welcomed the decision, and he promised to sign the document on Monday. But only to learn of the change of heart through that letter. And indeed, let me explain, Abu, that on that letter, they say that there are issues which are county-based. But they go and highlight 3 issues that they even wrote a previous letter that you do not have. They said that the counties lack financial ability and what we call now a policy framework to engage and resolve those issues. That is why the Minister of Health came in place and actually took the leadership to ensure that the 18 items that are on our return to work had been reached.
All right.
And there is no way they now run away, giving lame excuses. And you'll see the double speaking on that letter.
All right. We will come to that later. You say I don't have, I actually have it here. Nonetheless, we are talking of the employer, the Council of Governors, the governors. Yes. When they say these are county specifics, they have a point, isn't it? As per the 4th schedule of Kenya's 2010 Constitution, health is a devolved unit. These are your bosses who are saying these are specifics to the counties, so we can't generalize this agreement to cover up for the all counties.
Policy issues are national issues. They are not county issues. And that is the policy issues we are talking about, which they have admitted they do not have any framework to engage. And all the negotiations, including CBA negotiation, are done centrally. We fully acknowledge that there is 47 counties in this country, but the issues that touches on policy, they are left to the Minister of Health. But they have to participate because by one way or the other, they are the employer. But it is insincere to turn around because of the head of the clinical officer, which we feel that it is profiling clinical officer because the one of the cadre has already gone through the same process, which you acknowledge. Why the turn of event and change of heart for clinical officer? We feel that this is where we feel that discrimination and frustration to clinical officer is actually being done by a method on us by the Council of Governors by virtue that maybe they do not want to see us on the limelight or rather even negotiating on issues touching on our life and health. And this must be able to, Kenyan must get to know that what we are saying is that we came out because our life and health were threatened. We were working in an environment where we couldn't be able to get quality PPEs which are adequate to us. We were being forced even to work after testing positive for COVID-19. So they must be able to get to know that the issues we are raised are not personal issues, are issues that are policy-based and they must be able to be provided.
Fair enough, George, and we will find time to talk of the specifics of the issues you want addressed. Nonetheless, the signed deal on the 1st of January this year had 17 points, which was a return to work agreement.
Sure.
Just for purposes of clarity, once again, how many of these points and agreements were, as you say, violated or shortchanged?
None of them stand. A return to work is only one, and that is the document that was providing for 18 items. And once you have descended on everyone, you'll see that they actually highlighted a few of them and they left others. But we said that that is the only one document. A return to work is only one. And that is the one that also had provided for members to go back and provide for their safety to continue offering services. But once you have taken away their goodwill, we feel that this act of insincerity by our governors and our leaders, that is what we are trying to address. And indeed, we have not issued any other strike notice. We are actually going back, resuming on strike to support the president, the head of state, for having intervened and ensured that there is normalcy in the public health sector through the Minister of Health and the CS Labor and his leadership. So we want to say that all these people have been on the table. When they change, and the question we should be able to ask them, why did they change on the change of heart, and even what is it that they want to be changed on that document? Why should it that during the clinical officer is when they want it to be county-based? But all the items that we have highlighted, a majority, are quite homogeneous to what the doctors had already signed.
You say the agreement is one, despite having 17 points that the union wanted addressed. If the Council of Governors, or as part of another agreement, there are issues from these 17 points that will be addressed, do you want the totality of the 17 points being addressed once, or you can reach a consensus?
Abu, let me say that the issues they have highlighted that they feel so much maybe not contented with are: one, there is one that touches on enhanced group life insurance for clinical officer. What this one provides for is that clinical officers who might lose life, or maybe by virtue of the infection of COVID-19 are adversely affected, they should be compensated. The governors are against this. We have lost now about 11 clinical officers, and all of them have not been compensated. A number of them are very young, living very young family, are in destitute. But the governors want to say that we cannot compensate you. That is what they are saying. The other issue is that the Council of Governors, through their leadership, counties have been employing clinical officers in dubious contract that they pay them 15, way below than what is provided under the salary and the remuneration policies. So we say that we need to harmonize.
They are paying them
15,000. And you know that what we are saying is that they should be paid what is applicable at the entry job group. And if you look at who is the person who is joining the same qualification, joining at the for the permanent and pensionable, will be paid around 80,000. So when you pay someone 50,000, this is a forced labor. And we are saying we need to harmonize these people. And when we are exposed, all of us, the COVID-19 does not choose the person on permanent and pensionable, does not choose who are paid well, does not choose who is poorly paid. These people are equal. They are all Kenyan, paying their taxes here in the country. That is what we need, equal treatment. Indeed, in the Employment Act Section 5, it is very clear on terms of employment on how you need to ensure that there is equity. And that is what we are calling for people to observe. The other issue is about the health risk allowance. This is an issue that started in 2017. It was an issue that has been sitting there without being resolved before even COVID-19. It cannot be pegged with the COVID-19. And we are saying during this time around, the Kenyan government reviewed the health risk allowance only for one cadre, leaving all the other cadres out. And that is why we have been saying they must be able to harmonize so that people feel that they are also acknowledged in the services they are doing. Because even when COVID comes, it demonstrates clearly that it does not choose and it does not select. It comes and look into the issue. And what we say is that there is
Judge, let me interject you at that point. You talk of risk allowance. You say it cannot be pegged on COVID-19, be it the virus or not. The Council of Governors says that it notes some of these issues will attract monetary implications. You want the risk allowance, which requires a minimum increment of 500% to 650% to only 2 cadres.
I think that is politics.
That's not politics. These are numbers that the Council of Governors is saying, is it?
Those are politics, and that's why we are saying that we are healthcare workers, and our work is just about health. We are not politicians. We leave the politics to politicians. What we are saying is about harmonization.
Fair enough, George. Let's leave politics to politicians, as you say. But this, at the bare minimum of mathematics, has a monetary value attached to it. And that's what the council is saying.
They say that, but is it a fact? It's not. It is just profiling clinical officer. When you talk about harmonization, you cannot talk about numbers. What you need to look is, what is it that you're harmonizing? Is it really there was issues glaring that need to be addressed? Yes. And if at all that is what you are addressing, you cannot go and profile clinical officer in terms of the percentage that you presume that that's what you know. Indeed, we want to say what we want is that we are least paid. But when you look at the parameters that inform the health risk, clinical officers range ahead because they are the front line. Let me tell Kenyan this. When a patient comes without any symptoms of COVID, the first person to see this, first professional person to see this patient is a clinical officer. And you'll be sitting in an enclosed room where there is no good circulation of air. And this is actually putting you in risk. And you take at least 15% with that patient. And when you release this patient outside there to any other professional, you have already cautioned them. So who is at risk? The clinical officer. And we are the least paid, 3,000. We are only saying, take us near to those who are highly paid in the ministry.
All right. We are speaking to George Gibore, the General Secretary of the Kenya National Union of Clinical Officers. Keep talking to us. Send us a message on 22047. We are taking a short break. We'll be back with the third part of this discussion after this break. Tonight with me, Abubakar Abdullahi. We are talking to the General Secretary of the Kenya National Union of Clinical Officers, George Gibore, amidst a looming strike that begins barely in 2 hours' time. George, the union today announced that it is resuming a strike that was called 7 days before. First, that starts midnight tonight, is it?
That is true, that we are activating our strike after resuming duty on first. The goodwill that we gave and actually the document that provided for us to go back on duty have been refused, have been disputed by the employer. And they have resulted to intimidate and even dismiss our members. So after doing that, we have got nothing that have been left but only status quo to ensue.
And this means the healthcare system will continue to be paralyzed.
Indeed, it is a very bad situation that we are in. And it must be remembered that schools have been opened and there is a lot of interaction going on and people moving around. And indeed, the health sector, public health sector, cannot at any time during this time around be said to be actually a guesswork. And I need to say that what we are doing, after the president intervened under the Minister of Health, the Minister of Labor, we were able to go back. But the governors have done the other ways. We are actually in support of the president's decision, and we are protesting the undoing of the governor, who actually presumably are undermining the decision of the president to ensure that we normalize the services in the public health sector. And that is what we are saying. We will be starting on Monday. We will start to have a countrywide peaceful demonstration against the decision of the Council of Governors. Remember, we have a document that if it is ascended to this night, there is no strike. A signature that does not even require a single minute.
And this is whose signature? Just for purpose of clarity once again. For
purpose of clarity, and the Kenyan need to know that that document only need the signature of the chair Council of Governors, Governor Oparanya, and his counterpart, Governor Ngwai. These are the only two people who are supposed to commit the counties. Because in the Ministry of Health, the CS had already indicated, put his signature, and also in that there will be a witness who is now the CS for Labor. He's supposed also to indicate his signature after all the parties have signed their document, that document. So we want to say, we are not in that normal strike. We are in a strike where we are demonstrating against the act and of course the insincerity of the Council of Governors.
In my earlier question, your response was that the counties and the governors are undermining the president in this.
Precisely.
How
we
so?
feel that if the president intervened and was able to reach to us through the Minister of Health, CS Mutahi Kagwe, and also his representative, that is Honorable Cherugei, and the PS Engineer Tum, have done tremendous good job by bringing the teams together so that we are able to agree and come up with this document. If indeed the Clinical Officers Union are the only who came up with this document, and that the Council of Governors never participated. Let them tell Kenyans, because there is record, and the record do exist in the Ministry of Labor. We need to put the meat where it belongs. The rights that Kenyans need to get to know, because when politicians get airtime, they lie to Kenyans when they are facing the cameras. And we are saying that we are available as a live testimony that these people were on the table, participated. It is just only a change of heart, which we do not know what is the driver.
All right. You say it needs the signature of the Council of Governors. The Council of Governors, in a letter that we earlier talked about, says these are county specifics. At the heart of these are Kenyans who are bearing the brunt of this strike.
I beg to differ with them, because when they say they are county specific, we only have one country. And all our pays, for those who are civil servants, we draw our pay from our central part. Our salaries are harmonized from a central place. The decision and the negotiation are always done from a single place. There is no county that do exist with their own policy. And that is why even when COVID-19 came, the Council of Governors could not run their own independent system of releasing result for COVID-19 and even updating. That is why we centralized it. The issues that touches on healthcare workers cannot be said county-based. And in any case, if they were true, they will have mentioned a single item on our return to work that is county-based. And we dare say, they are running away from reality, that county government allocate resources for promotion of healthcare workers. But a year later, after that annual budgetary ends, the annual budgetary ends, you find that they have not done anything, and you cannot account where this money went. These counties start from Kakamega, Vihiga, Laikipia, and Kirinyaga. And these are some of the counties. Since the devolution, our members have never been promoted.
All right. And because of the interest of time, one final question. What does the council, the union rather, need tonight? If you are to sign any agreement, what are the top issues you will want the ministry or the government or the counties to address in less than a minute? For
purpose of clarity, is that the document still apply to those who are the national government, and for those who the CS can substantively provide for. But for the counties that have already descended on this document, the strike will begin tonight. And the strike is in demonstration. We are actually demonstrating our trust in the president for intervening to resolve the issues of on health and ensure that there is normalcy. We are protesting the decision of the Council of Governors to intimidate, to discriminate, and to frustrate clinical officers. The document do exist. Only thing that we need is that the Council of Governors through their representative, append their signature and allow normalcy in our public sector so that we can be able to offer services to Kenyans. And we can assure that if this is done, clinical officers will be back and happy and deliver services.
George Gibore is the General Secretary of the Kenya National Union of Clinical Officers. Thank you once again for making time for us.
Thank you very much, Abu, for having us and for providing us an airtime to inform Kenyans what is bedeviling the health sector. And I need to mention as I end that we need to centralize management of the human resource in the health sector. When you look at what is happening in the country, that since devolution, we have had more than 103 strikes in this country, only for the health sector. And the reason is that when decision is made from one center, the other center want to run away. We want to say that it is evident that if indeed there must be a BBI, the issues of the Health Service Commission cannot lack. If this one is there, it will be able to provide answers to the Kenyans, and we can be able to stabilize the services to Kenyans through the health public service.
Once again, thank you for making time for us. Keep talking to us. The hashtag to use is TV47 News. Send us a message on 22047. The discussion continues.